super excited about talking about how you can elevate your practice with some successful secrets to credentialing. Credentialing, hands down, is the key component to being able to bill insurance, which can also provide you with another line of income. And I am all about having multiple streams of income. So really, without further ado, let's go and discover the secrets to success, to a successful credentialing in mental health. So our goals today is going to be to just simply talk about what is credentialing. That's the first goal. Secondly, are you prepared? Then we're going to jump into kind of looking at the different types of credentialing you could do. You can do group credentialing, or you can choose to do solo credentialing. And there's some advantages for some people for both, to be honest. We're going to talk about the investment. Credentialing usually, unless you're doing it yourself or someone in your office is going to be doing it, there is an investment. Even if you're doing it yourself, even if somebody else in your office is doing it for you, it is still an investment. May not necessarily be an investment of time, of money, but it'll be an investment of time. And we're going to talk about timeframes and outcomes. We're going to visit over some critical components of credentialing. And we're also going to talk about maintenance, because it is a real thing when it comes to credentialing. So let's get started. So the first thing that we're going to talk about today is basically what is credentialing and contracting. And I like to compare the two. Many people, when you speak about, or you hear people speaking about, or you even think and talk about it yourself, you know, you put those words together, credentialing and contracting, or you just simply say credentialing. Well, the reason why I broke these two out is because it is a two-part process. There is credentialing, which comes first most of the time, and then there's the contracting phase. So what happens with the credentialing phase? Basically, it's verifying your credentials. It's verifying your background, your education, your training, your work history, your license, your board certifications, your tax ID number, NPI, and any taxonomy numbers you've got. It's looking at your malpractice history. It's looking at whether or not the type of provider and or group that you are, is it going to fit within the insurance standards? Every insurance has its own standards. We'll talk a little bit about one of those standards called an open panel. Oftentimes, the credentialing process and the contracting process as well is managed by a committee or a third party. So that's pretty much what happens in the credentialing phase. You are really kind of being investigated, if you will. And then for the contracting phase, it's the establishment of your contract. Of course, it's a legal binding relationship that's being formed. It includes the name of solo clinician and or group. So if you're asking the insurance company to credential you as a solo clinician, then the contract should include your full legal name. Same thing for the group. It should include the full legal name of the group. We'll talk about that later. That is super important. The contract sets standards for treating patients, like what their expectation is for you with treating patients. An example of something like that might be your expectation that if you're in the network, you're going to bill the claim and you're not going to balance bill the patient for anything outside of what their responsibility is for seeing an in-network provider. Covered services. The contract will spell out what services in general they are covering based on your specialty. Additional plans, they will oftentimes tell you that, hey, I know you wanted to be credentialed with just United Healthcare, but with this particular United Healthcare application, you are going to also be in the network with Oscar and with other types of United Healthcare plans. So that is a real thing. You can fill out one application, and for some insurance carriers, you're going to be in the network with various different plans. And sometimes that also looks like an EPO plan or a PPO plan or an HMO plan. Then, of course, which is the most exciting thing that people like me look for, and that's fee schedules. Fee schedules are so important when you are getting your contract back. The contract itself is important, but the fee schedules is what we're all going for. If you hire a credentialing representative, that's what she's looking for. She wants to make sure that the fees are attached to your contract. And we'll talk a little bit about fees later on in the presentation. They've got termination clauses in your contract, claims following standards, and timeframes, payment timeframes, and the utilization review requirements, which is, to us, it's really called pre-cert. So you guys, excuse me, I'm dealing with a little bit of sinus today, sinus drainage. So I'm going to be sipping on my tea so that it can help me with my my throat. So hopefully I sound clear and easy to understand. Otherwise, I can kind of sound like there's some mucus on board. Let's move on. So the next thing we really want to talk about is, are you prepared? And this is huge because being prepared to do your credentialing is very important. If you do it yourself, if you hire a credentialing professional, there are certain things you're going to need to be prepared to do. It's kind of like anything else, y'all. You know, if you have a baby, you know, you don't want to start planning for the baby to come on the day of delivery. You want to be planning for that child and getting things in order for this new sweet little person to come into your home pretty much right after you find out they're coming. The same thing is true for credentialing. You really want to start preparing ahead of time. Here's a quick, short list. Number one, your business set up legally and correct. And these are little things that's intended for you to kind of check them off your list. So if you're new you're a new provider, you just finished your training and you're ready to start your own practice. And one of the things that you want to do right now, you're accepting cash because right now cash is king. You're not in the network yet, but you're moving toward getting in network with insurance carriers. And what you really want to do is take this checklist and make sure that you're getting things done. So you want your business set up legally and correctly. Well, what do I mean by that? Well, number one, you want to make the decision early on. Do you want a group practice or do you want to be a solo provider? And we're going to get more into that into the next slide. Whatever that answer is, it's okay. It's your business. It's your practice. You can do it however you want, but you want to make sure that it's set up legally, meaning that you're registered with your state. You've got the appropriate business license for your state. You want to make sure that you've got a business W-9 that has been filled out, completed, and updated with the current date. You want to make sure you've got a tax ID number and a letter from the IRS. We're going to get into tax ID numbers versus using your social security number a little further down the road. Articles of incorporation. So if you've gone through the process of setting up a legal business, you ought to have articles of incorporation. If you don't, then I would suggest you go back and double check your legal business setup because you should. You really need a business bank account and you need to already have voided checks. And let me tell you a little something about voided checks. The voided checks that you get, or a check that you can void, needs to have, so it needs to be your permanent checks. It can't be the ones that the bank give to you right after you open up an account. It really needs to be your permanent check that's got your business name on it, maybe even your tax ID number, your business address, your business phone number, maybe even your name. If you're the business owner, maybe right under the business name, your name is listed there. However it is that you've set up your account. But these are actually some helpful hints for how to set up your business bank account. Because as you start to work with insurance carriers, and you're going to want them to pay you electronically, and we'll talk about that a little further in the presentation as well, you're going to need to present to them documentation that represents that you have a valid business account. Your personal account will not work. It's not advisable. Let me correct that. It might work, but it's just not advisable. CAQH database completed. CAQH is something that every single clinician, I believe, whether you are billing insurance or not, should have set up. If you want to know more about CAQH database, either Google it or send me an email or hit me up and let's jump on a discovery call and we can talk a little bit about CAQH and why you want to have one and give you some tips on completing it. The most important thing here is your malpractice insurance. Not only do you need to have your malpractice insurance, but you need to have malpractice insurance with claim limits of $1 million for the claim limit and aggregate of $3 million. This is the average coverages that in my 20 years of dealing with insurance carriers and doing billing and collections and credentialing, this is the average amount that they require. And I stay pretty much in the mental health arena. So this is my experience based on mental health providers, MDs, PhDs, lower level providers, nurse practitioners, PAs. They require at least that's the average amount, at least that amount. And then your CV. You do need your CV to be completed and updated with all of your current employment. I'll tell you a little thing, a little tip about CVs. Of course, in our world, obviously when I started out, it was, and a person that's not a medical provider, a CV is called a resume. So your CV really does need to mock a resume. They want to know in numerical order in terms of earliest to latest, your work history pertaining to your license. So you don't need to put everything that you've done from the beginning of time up till current, but I would at least go back 3 to 5 years. And depending on what type of provider you are, I might go back 5 years. So if you're an MD, I would make sure that my CV goes back at least 5 years and up through my point of residency, because that's going to be very important. Any jobs that you had outside of residency, very, very important. That information gives the insurance carrier a clear picture of what type of providers they are bringing into their network. Because once you are in network, and this is a little marketing tip I'm about to drop on you, once you're in the network, the insurance carrier actually markets for you. And we'll talk a little bit about that in a different webinar, but the insurance carriers will provide some sort of marketing for you. Also, very important, your license and your malpractice is current and expiration greater than 6 months. All that really means is, I know you guys get busy, you're working, you're doing your thing, and all of a sudden it's time to get your license renewed. Well, if you're in the process of getting credentialing, or you getting credentialed, you want to start the process, or you're in the middle of it, you've got to make sure that your license and your malpractice insurance stays current. And as you develop your CAQH database, the copies of those license and malpractice gets uploaded to that database. CAQH, circling back to that, is so very important because this is the database that the insurance carriers will access to get all of your information. Some providers or some insurance carriers want you to provide it to them directly in an online application by logging into their portal, etc. Most of them these days will go to the CAQH database to actually get this information. So, and they're going to be doing it behind the scenes. You'll never know when they do it. When you do set up your CAQH, you do have to give permissions to insurance companies to access it. So that's how they're able to access it. So you've got to make sure that these documents are updated. Taxonomy codes, you got to know which taxonomy code applied to your specialty and or to your group. Again, if you want to know more about taxonomy codes, I'm happy to have a conversation with you. Just, go to my website and book a discovery call, and I'm happy to have that conversation. You will need an NPI, whether for your individual and group. If you're doing just an individual, then you just need an individual NPI. If you're doing a group, if you're credentialing a group, then you're going to need a group NPI. Again, you're going to need to know your areas of specialty. So, for example, if you are a psychiatrist, they want to know, do you plan on providing psych testing? Do you plan on providing neuropsych testing? They want to know what type of psych testing you plan on providing. They're going to want to know, are you planning on providing TMS services? They're going to want to know, do you plan on providing ECT services? They're going to want to know the types of specialty care that you are going to be offering to their patients in their office, in your office. So it's going to be pretty important that you already know that. That's why I recommend starting on this list sooner than later. The days and hours of operation, got to know that. That's going to be super important. Again, because the insurance carriers does some marketing for you, they are going to need to know what hours and what days you are in the office. So as they tell patients about you, they're also able to tell the patients what days you're available to them and what hours. It's going to be very helpful and important that if you've got providers that speak different languages, that you are putting that on your documentation, which the main source of your documentation, again, is CAQH. So if you've got other providers working in your group, you need to make this information known to whoever is going to be doing your credentialing, because you're going to put in your CAQH database whether or not you speak a different language. Like, I happen to work with several providers that speak Spanish. Some of them speak Arabic. So I do have providers that speak other languages. And when you're building up your CAQH database, that is a question they ask you. So please fill that out, because there are patients that are going to want to know if they can seek out a psychiatrist or a nurse practitioner in their area that speaks their language. So that's one of the ways that insurance carriers as well can connect you with patients. So very important piece. And then you want to prepare yourself a list of the insurance panels you desire to contract with. That's huge. And I would say in the beginning, when you sit down to make this list, just make a wish list. Write down every carrier you can ever dream of that you want to be in network with. Doesn't mean that you got to do them all at once. Matter of fact, I recommend that you don't. What I recommend is that after you make this list, you go back through with a yellow highlighter, and you would want to highlight your top 3 to 5 carriers that you feel like, man, if I get in the network with these carriers, this is going to be a game changer to my business. That's what I recommend that you do. If you're doing your own credentialing, or you have someone in-house doing your credentialing, it is going to be imperative that you stick to 3 at a time, especially if you are unaware of this person's capabilities when it comes to credentialing, managing credentialing contracts, and you've gotten more than 5 of them out at a time, that's a standard for a professional credentialer. They can do anywhere from 3 to 10, 3 to 20 at a time because they're prepared for it. They understand how to do it. So make your wish list, put 20 of them on the list if you want to, 30 of them, whatever. But I do recommend that you go back with a yellow highlighter or whatever your favorite color highlighter is, and you would just highlight 3 to 5 of them that you would want to start with. And those need to be the big ones. What do I consider the big carriers? I would say Medicare, depending on what type of population of patient you want to serve. I would say Medicaid. I would also say Blue Cross, Aetna, Cigna, United Healthcare, Optum, United Healthcare and Optum, they're kind of one and the same. So those are kind of sort of the big boys. And don't leave TRICARE out. TRICARE East, TRICARE West, depending on what location you're in, you definitely would want to consider TRICARE. I highly recommend those, that group, that you would start there. So moving on, I think we've talked about your list. So get your list and start working on it. Check it off and then check it twice. So now we're going to move into talking about a solo provider versus a group provider. I debated about whether or not to put this in the presentation just because I wasn't sure who would be showing up, who would watch this. But I kind of wanted to put it out there for wherever you find yourself. So I want to encourage you that credentialing and contracting is for any medical provider that is licensed, that desire to accept insurance and want to work with insurance patients. Okay. So if you're a solo provider and you want to be credentialed, the most important things that you're going to need to know, again, this is all in my opinion. Some other credentialing representative may tell you something different. This is in my opinion and based on my experience. So a solo provider, definitely you're going to need an NPI. I think the big things that is important for a solo provider that is just, it's tempting to do, it actually makes good sense, is when, especially if you're filling out applications yourself, when they ask you for a tax ID number, instead of going out and getting yourself a tax ID number on the irs.gov website, which is super easy, takes you about 10 minutes, you use your social security number. And I just want to remind you, that's not a good idea. Why is that not a good idea? It's not a good idea because hundreds of thousands of people will be handling your information. And everybody that handles your information has access to your social security number. So it's just not wise. Can you do it? Is it doable? Is it acceptable? Yes. Is it wise to do it? I don't recommend it for privacy purposes mainly. And it has absolutely no real tax benefit to you in that way. So it's going to be best that you get a tax ID number. It's also best to get a business address, not your home address. I'll tell you a funny story real quick. I was working with a provider probably about 5 years ago. She had done her own credentialing before she showed up on our doorstep. And she called me one morning and she was just frantic. This lady was a young lady, a young mom. She had just had a baby. She was getting her baby ready to go to daycare so she could get to her office. And lo and behold, her doorbell rang. She goes to the door and opens it. And it is a patient that's looking for her office. So, of course, she's stunned. And she immediately starts to explain to the patient they're in the wrong location, gave the correct location for the office, and the patient left and met her at the office later. Then she called me frantic because she didn't understand how that patient got her home address. Well, as I researched it and dug into it, there was an application, a insurance credentialing application that she had completed on her own, and it ended up getting approved and getting entered into the system with her home address. So, always get a business address. Do not use your home address. Another thing that you might want to understand is that even if you get a tax ID number, all the payments are going to come in your name. With that being said, there's really no tax shelter for you. So that means every dime that you make, you pay taxes on it. Versus if you set up a business name and set up a business, you establish an LLC, and hopefully you determine to file it as an S corp. Then now what you're doing is you're providing a tax shelter for yourself, which is kind of listed under the group provider there. If you want to add providers, if you're a solo provider and you want to add providers, it can get complicated. It's best to create a group. There are people that I know that have found a workaround in the system, but it can get into a little bit of a messy situation if you're technically a solo provider, but you want other people to work in your business for you. So let's listen to what would happen if you're a group provider. Group provider, you need a group NPI number, and you also need your individual NPI number. So the group becomes an entity in and of itself. Tax ID number is required. You need a business name and address. I want to say something here about addresses, and this applies to solo and group. With addresses, you really need to have a business address, not a P.O. box, but a business address. Insurance companies are not working with P.O. boxes as a business address anymore. They will allow P.O. boxes in other circumstances, but your business address needs to be a legal street address, something they can Google and or go and visit, because some of them will come and visit you. You do need a taxonomy number for your group. Again, if you set up an LLC, that is a tax shelter. You're able to add providers pretty easily. And to be honest, you can set up a group and you can be the only provider of the group. And this is what I recommend for you. If you're not a person that's looking to have 10, 12 providers working in their group, that's okay. That's fine. You can set up your group and you're the only provider in that group. And you get all of these benefits. And then it gives you room for growth. You can add multiple providers. You can add multiple locations. You can't do that with an individual provider easily. It can be done, but it's not easy. So now let's talk about your investment. So this is the part where most providers kind of are like, they kind of are standing there waiting for, the what is this going to cost me? And listen, I'm not going to kind of dance around it. Credentialing can be expensive, but you do get what you pay for. It is an investment, and you are investing in your business, your future business. You're investing in yourself. So you want to work with someone that knows what they're doing and they've got the experience behind them. So credentialing representatives spend hours of time completing and submitting and following up on outstanding applications. They rely on your prompt response. As you go through the credentialing process, your credentialer will need your input for something or another. It's happened on every one that I've done. Slow response delays your outcome, which means you're going to get a delayed approval date. Credentialing agencies and representatives depend on your timely payment. If you made a payment arrangement with them, y'all please keep it, because again, these people spend hours of time working on your credentialing. So when you don't pay on time, or you miss a payment, or if something, communicate with them. Get something else set up in the times of a payment arrangement. But do try to make timely payments, because it's going to help you keep your credentialing moving forward. A professional credentialing agency or representative have the experience necessary and the skills necessary to navigate any challenges and can produce a positive outcome. And here's the big thing. This is something that I had to help my providers understand on more than one occasion. That just because you hired me to do your credentialing, it doesn't mean that I can make the panel be open. If we send in your application or your letter of request to become in network with the panel, insurance company, whatever you want to call it, and they say no, we cannot, no credentialing representative can make them open their panel. Now, there are other things that she can do, and she knows what those tools are. She knows what those back doors are that she can do to go and seek another alternative and present you in a different way to that insurance carrier to see if they would then open up the panel for you. But if the panel overall is closed, she cannot make it be open for your case. It's just closed. All right, so let's talk about outcomes, timeframes and outcomes. Well, the average time frame from start to finish for your credentialing is 90 to 120 days. Sometimes, and I really want you to hear, sometimes the approval comes sooner, which could be 45 to 60 days. And what I mean with these time frames, you guys, is I'm talking somebody that's never been credentialed with an insurance carrier before, and they're just starting their credentialing. And I'll talk a little bit about the difference between somebody that's been credentialed before and somebody that haven't. We'll talk about that just very superficially. That'll probably be involved in another webinar that we'll do, but I'll give you some insight on it. Insurance panels only provide updates every 30 days. So this is to set your expectation. I've had so many providers show up on my doorstep, and they're looking to switch credentialing agencies or representatives. And I'm like, well, why are you wanting to switch? Well, because, it's just going too slow. And I dig a bit further, and what I find out is that their expectation is that they get some sort of progress report, or they're being informed like every 2 weeks or something. And it just doesn't happen like that. Insurance carriers do not provide updates but once every 30 days. If the credentialing agent has got a friend/contact at that insurance carrier, she might be able to slip through a back door and get an updated an update on where your credentialing is, an updated status, but that's rare. You are in the network when you receive a welcome letter/email on the insurance carrier's letterhead stating your effective date. Please, 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 if you don't remember anything I said today, please remember this. Just because your credentialing representative said to you, okay, I finally got your approval. I called and they told me that you were approved and your effective date is May 1st of 2024. Please do not start seeing patients from that insurance carrier until you get your letter on letterhead stating your effective date. All of your license and malpractice insurance expiration must remain greater than 6 months. I'm repeating that because that will shut your credentialing down. if they are at the point of ready to offer you a contract, oftentimes in the background, the credentialing committee is still going back there at certain time intervals and checking your licensures and your malpractice and even your background. And if your malpractice or your license is about to expire, it's within 6 months of expiring, they can actually hold or shut down your credentialing. Most times they don't shut it down unless nobody responds to their request for an updated license, or unless you just don't get the updated license done. So that's really important. Make sure that you take care of that. And your credentialing representative will help you navigate all of this. All right, so here's some critical components of credentialing, and I'm just going to touch on these, guys. I believe that this webinar is going to be uploaded to our website, so you'll be able to go and download it and listen to this any point in time. Isn't that funny? You can listen to my voice anytime you want. So, some critical components that I really wanted to introduce you to, make you aware of, is EFT, first of all. EFT is a critical component that goes along with credentialing because it's an electronic transfer of payment. After you are in the network with insurance companies and you start seeing patients, you need to be able to get your money deposited directly into your bank account. You don't need to play the game of, oh, let me mail you a check. It gets to the post office puts it in somebody else's mailbox. You never see the check, but yet the check has been cut, right? So, and everything online indicates that you've been paid. Skip that nonsense. Get electronic fund transfer set up. This, in most cases, is done directly after contracting. And let me also add, it is a separate service. It's a separate task. So I don't know, but most credentialing companies that I've worked with in the past, they don't do EFT setup. So EFT setup has been, if you can find a credentialing company that does it, great. Guess what? CBM does it. But I can tell you that that's usually a separate service. So what I'm saying is that an additional cost will be attached to that. Single case agreement. Single case agreement is such a valuable tool. I get so excited about single case agreements because while you're going through credentialing, and I'm not talking about day after you submitted your application, I'm talking about maybe 30, maybe 45 days into the credentialing process, you can try, there's no guarantee, but it is a tool, you can use it. You can try using single case agreements as a tool to see patients from certain insurance carriers. Here's how it works. It's a temporary agreement between the clinic or the clinician for a short period of time that pays the clinic or the clinician according to in-network rates. That's the good stuff, guys. And for services covered while the clinic or clinician is subject to network guidelines. So what this is saying is, this is a temporary in-network contract that's going to hold you accountable to the in-network guidelines. But here's the big thing. They're going to pay you just like you're an in-network provider. So you're going to be providing services for these patients. That's, let's say this is Aetna. You're trying to get in the network with Aetna and you're using a single case agreement to treat Aetna patients before you're officially contacted with Aetna. Guess what that's going to do? That is going to cause them to speed up your contract. So because, and it's good, it's a step of good faith because you're showing the providers, hey, I'm willing to step in. You're showing the insurance carriers, I'm willing to step in and start seeing your patients right now, although I know I am not in the network. I want to make it clear, single case agreements doesn't work all the time. Sometimes there are stipulations that go along with them. we can talk about that on a discovery call. So make sure you get your discovery call in. EAP Assistance Program, that's another great tool. So again, while you're waiting for your credentialing to be complete, you can go out to Cigna and you can sign up with their EAP program. It's a benefit that's offered by employers, and I misspelled employers, y'all, I'm sorry. As a part of the benefit package, it's free to the employee. Most offer coverage for mental health and substance abuse services, among others, and payment is lower than in-network rates. But here's the deal. It's money in the bank all day, every day. So yes, the payment is lower, but what are you doing? It's a tool. It's a tool that you're using to get one step closer to being credentialed. You're showing this insurance carrier that you're willing to work with their patients, although you're not in the network. And I will tell you, most EAP assistant programs give you 8 visits. So let's say they will pretty much another contract, but it's very basic, very simple, but they give the patient 8 visits. And those 8 visits, you are paid 100% of your allowed amount, whatever that number is. It's low. It's usually under $100. But y'all, that's another stream of revenue that you got coming in while you're waiting to be credentialed. And guess what? Your name is in the system. They see that you're seeing their patients. The patients are happy with your service. All of that promotes them to kind of speed up and turn up the fire on your credentialing. Mainly, it's going to be beneficial as a line of revenue for you coming into your practice while you're waiting for your credentialing. And hopefully, with 8 visits, and if you're only seeing the patient one time a month, then maybe you'll be credentialed by the time their EAP benefits run out, and you can just convert them to an insurance patient, keeping that patient in your practice. Now, the other component, which is critical, you don't need it right after credentialing, but you do need it before you start billing insurance. And this is your electronic remittance advice, your ERA. It's electronic explanation of insurance payment. It needs to be set up prior to billing insurance. But in order for you to set this up, you also have to have a billing software or an EMR. EMR is nothing more than medical records with a practice management platform attached, and they're all in one software. So you need something like that. So that, because when you get that software, every software comes with a clearinghouse. We can talk about that in a different call. But these electronic remittance advices comes electronically into that clearinghouse. So this is all very important information for you to keep in mind. We can talk more about this. Again, all of this information is going to be on our website. I've got a couple of more slides and then we'll be open for questions. So re-credentialing is real. So once you are credentialed with an insurance carrier, it's not a one and done deal. They will require every 3 to 5 years, depending on the insurance carrier, they will require that you get re-credentialed with them. And basically, it's just their way of making sure you're keeping up with your license, you're keeping up with your board certifications, or maybe you got some new board certifications. Maybe you were once a PA when you got credentialed with them, and now you've gone on and decided, I want to be an MD. Well, you got a different license. So all of these things are important to them. And it's their way of making sure that they're still offering quality providers to their pool of patients. Keep your CAQH updated. I cannot tell you how important that is. CAQH, when it comes to credentialing, is a vital component. Keep your licenses clear from legal issues. Not very long ago, I'll tell you a quick story. I had a doctor show up on my doorstep, wanted to be credentialed with Cigna. I did all the paperwork. The team did all the paperwork. We started following up and doing our due diligence as we are hired and paid to do. Come to find out, this particular provider had some legal issues going on in the background, and Cigna, would not accept him in their panel. He got a rejection letter. So anything can happen to anybody. We can't foresee the future, but do what you can to keep your license clear of legal issues. And that is it, y'all.